Afternoon, and thank you all for joining us as we share some really great news about the health and safety of our community. As part of our data-driven approach to public safety and health, and because of our commitment to continuous improvement, we annually evaluate our cardiac arrest survival statistics. And to be able to compare our statistics with other communities for evaluation purposes, Lincoln Fire and Rescue is a member of CARES, the Cardiac Arrest Registry to enhance survival. Today, we are pleased to announce that our survival rates for those in cardiac arrest in 2021 have improved over the previous year and continue to rank significantly above the national average. In both 2020 and 2021, LFR responded to 148 cardiac arrest cases caused by a medical event and not a traumatic injury. Lincoln's survival rate for these emergencies increased from 16.9% in 2020 to 20.3% in 2021, and that is far above the national average of 9.1%. We're releasing this data during National EMS Week, and these statistics demonstrate the life-saving work of our community's emergency medical services professionals. These survival statistics are the result of a team effort that includes our city's 911 Communications Center, our paramedics and emergency medical technicians, or EMTs, LFR's medical director, and Lincoln's outstanding hospitals. Our residents and our visitors are well served by their dedication and professionalism. And it's worth noting that our residents are not only the recipients of life-saving services, but also a meaningful part of delivering them. Lincoln residents once again helped us achieve this relatively high survival rate. Civilian bystanders performed CPR prior to LFR's arrival at a rate far higher than the national average. And here to provide more information about those statistics is a crucial member of our team, LFR's medical director, Dr. Jason Kruger. Dr. Kruger, thank you for your service and for being here today.
Thank you. My name is Dr. Jason Kruger, and I serve as the medical director for Lincoln Fire and Rescue. I oversee the emergency medical services protocols and procedures utilized by paramedics and EMTs in the pre-hospital setting in Lincoln. During this National EMS Week, we are proud to announce our community's 2021 cardiac arrest statistics. The mayor talked about the increased survival rate for non-traumatic cardiac arrest cases in Lincoln. Essentially, Lincoln affords a greater than double opportunity for patients to survive. In Lincoln, when a person in cardiac arrest is encountered, people are more likely to perform CPR prior to the arrival of LFR personnel. Of the 148 non-traumatic cases, bystanders were performing CPR 67.2% of the time when LFR arrived, compared to the national CPR rate of 40.2%. In 2021, our community brought 30 people back to life from sudden cardiac arrest. These people are now back at home, work, school, and with their families. If we were a completely average community, statistically, we should have saved 13 people from sudden cardiac arrest. Due to the hard work of our community members, our 911 dispatchers, our law enforcement, Lincoln Fire and Rescue EMTs and paramedics, our health systems, including nurses, respiratory therapists, emergency physicians, cardiologists, and critical care physicians, we gave 30 people a second chance at life.
A lot of proof that we are definitely not a completely average community. So thank you so much, Dr. Kruger, for the important role that you play in making all this happen. And also with us today is LFR Battalion Chief Jamie Pospasel, who was promoted to that role earlier this year. Congratulations again, Chief Pospasel, and thank you for being here to share more information with the public.
Absolutely, thank you. Good afternoon. I am Jamie Posfishel, a battalion chief and the incoming chief of emergency medical services at Lincoln Fire and Rescue. I'd like to thank you for joining us as we share this outstanding performance information. It is National EMS Week with the theme of EMS, Rising to the Challenge. Every success we enjoy matches the hard work of the men and women of this organization, but also the support of the people of our community. This is not just positive news for Lincoln Fire and Rescue, but it also reflects the willingness of our community to come to the aid of others in their time of need. This success is just a small glimpse of the continual outcome-based improvement we strive for daily. The operational decisions we make are driven by data and outcomes. We will continue to work closely with our medical director, Lincoln Hospitals, and the Emergency Dispatch Center to ensure we provide the best chance for pre-hospital cardiac arrest patients. Our providers have certainly risen to the challenge by demonstrating a commitment to performance and ongoing community relationship building. Therefore, Lincoln Fire and Rescue is one of the highest performing EMS systems in the country. Congratulations to the providers of Lincoln Fire and Rescue and the Lincoln community. It's National EMS Week, and it's a perfect opportunity to salute the paramedics and EMTs. Thank you.
Thank you so much, Chief Posfishel. And as she said, the theme for this year's EMS Week is Rising to the Challenge. It is clear that Lincoln Fire and Rescue is doing so every day, as well as our community members. So thank you to every member of the LFR team and to all of our first responders and their dedicated efforts and the life-saving services that they provide to our community members. And with that, we'd be happy to take any questions the media may have for us.
What do you think Lincoln is doing right that other communities may be lacking in?
Everything. No, I mean, well, first of all, we have really excellent professionals who are very dedicated and who train for these moments, right? This is the result of so much effort, proactive effort to be ready when someone picks up a phone and calls 911. And then, of course, we have these partnerships, right? We work closely with our medical director. We work to make sure that the public knows how they can be a part of this. And so we're so grateful that the public has stepped up to get trained in CPR and has been there on the front lines until that ambulance arrives. And then our hospital teams, I mean, the medical professionals in this community who respond quickly and with incredible skill. It is definitely a partnership that is helping this to work so efficiently and effectively and to ultimately save lives and achieve good outcomes in our community. I don't know if Dr. Kruger wants to add anything, or Chief? Yeah, come on.
No, I agree with the mayor's point, but I really think it is the focus on systems of care. And I think it starts with our community and the really extraordinary work of our 911 dispatchers to really key in on and pick up on cardiac arrest and be assertive and direct chest compressions prior to the arrival of EMS, which dramatically improves the patient's chances of survival. And then the integration with our healthcare systems. And we are one of the very few communities where if we catch somebody where we think they have a really good chance, we're going to take them straight to the cardiac cath lab. They may bypass the emergency department and go straight to the cath lab for life-saving intervention. So it's really been the focus on the entire system of care that I think has set us apart. Yeah, thanks. Any other questions?
Yeah, any other questions?
Why do you think civilians are more likely to intervene in Lincoln?
I really think it comes down to the work of our 911 dispatchers. I think we are blessed with a wonderful community, but I think it's their training and assertiveness that has really helped kind of save more lives.
Yeah.
Just add one piece of that, you know, over the years, the community and the city has done a lot to promote the Pulse Point app so that people can actually proactively decide that they want to be a part of an emergency situation and help save lives, get the training, be ready to be notified on their phones of an event nearby. So we have more people in the public just standing at the ready.
Yeah, that's awesome.
Yeah.
Thank you.
Any other questions? Right. Happy EMS Week, and thank you for tuning in. Take care.